Studio Bovine. With me in the studio is Professor Martin Green from the University of Nottingham. Welcome.
Thank you.
You gave a presentation today about predictive biology. Can you explain what it is?
Yeah, essentially it's to use the basic processes and mechanisms of biology to see if we can understand, in this case mastitis, how mastitis works, so that we can think about trying to prevent mastitis as a disease.
And how far are you in the research? Like, is it already applicable or is it very futuristic?
Well, I guess most of this is looking towards the future. There is some research going on in predictive biology in different ways. But essentially the premise we have is to think about, can we move from maybe the more traditional ways of controlling mastitis into think about what might happen in 5 years' time and 10 years' time. So in that sense, the research is probably not completely applicable at the moment, but we're using biology to see if we could think of ways that we might be able to apply it in the future. Yes, then on an everyday basis, but really that will be in the years to come.
Can you give an example of what kind of things you're looking at in relation to mastitis?
Yeah, so I guess an example of predictive biology that we're working on would be involving strep ubris. So strep ubris is a common pathogen in bovine mastitis. At the moment, we tend to just deal with strep ubris as a whole species, and we tend to believe that species tends to behave in a certain way on farm. But in fact, by understanding the genetic makeup or the protein makeup of strep ubris, we can start to differentiate strains of the pathogen which behave in different ways. If we can do that, then depending on the behaviour of each strain, we can think about preventing each strain in a slightly different way. So that's an example of understanding the underlying biology in terms of the genetics or protein expression in changing the decisions we might make about mastitis control.
What could this mean for like the way we treat mastitis? Because a lot of countries are working on decreasing the number of antibiotics. So how would this be applicable in that sense?
Well, I think it's really important in that sense because we talk a lot about treating mastitis and mastitis being responsible for a lot of antibiotic usage in the dairy industry. Of course, the secret to that is to prevent the disease. If we can prevent it in the first place, rather than think about all the time how we're treating it, then of course we won't ever have to treat it and we will reduce antimicrobials. So if we can use the understanding of biological processes to improve mastitis control, then ultimately, of course, the goal is to reduce antimicrobial use and the other benefits of improved mastitis control as well.
And what would it mean for the part of the animal well-being?
A huge amount. I think mastitis is often misunderstood in terms of cow welfare. In a way, we're so used to mastitis and we're so used to maybe cows getting mastitis in the dairy industry, we sometimes forget that each case is associated with an important welfare infringement. Even mild mastitis is likely to have a welfare impact on the cow, and of course the more severe cases that can be quite dramatic. So yes, preventing mastitis is really important, we think, for cow well-being, cow welfare in the future.
What is the role that the veterinarian can play in this part once it's being researched more?
So I think the way we see the elements of predictive biology coming together, we'll be making use of data which is captured on the farm or around the farm. It might be new diagnostic tests, but the veterinary surgeon will be very much at the forefront of this. So the veterinary surgeon will be involved with interpreting the data and actually understanding the data so that the new control procedures can be put in place. So predictive biology will lead us into new directions, but they're still directions that the vet will need to be involved with to implement and actually to undertake the changes with the farmer on farm. I think the difference will be, what we're trying to do with predictive biology is to try to forecast what will happen in the future. Rather than understanding what's happening today, predictive biology, we hope, will be able to forecast what is likely to happen in the coming weeks or months, and so the vet will be in a better position because control can be based around a forecast of what's going to happen as opposed to simply what's happening at the moment, which is really where we are now.
One final question, to predict it, to forecast it, is that based on data from the farm specific or on a bigger part?
So the data can come from lots of places, but really to be predictive on the farm, you will need farm data. That might be data about the cows on the farm, it might be data about their behaviour, their environment, their pathogens. Ideally what we see is that putting these data together will allow us to make good predictions for individual farms, but they will be different for different farms, and so you'll need the data for each of the farms individually. Yeah.
Okay, very promising. Thank you so much for your insights.
Thank you very much. Thank you.
Thank you for watching Studio Bovine, and hope to see you again.